We're live. We're recording. We're drinking. Well, I'm drinking coffee. All right.
Metaphorically, I'm too. Hello, everyone.
So I want to welcome my guests again. You're so, by the way, you're so generous with your time and your knowledge, and I know you're really busy. So we really appreciate you hanging in there and, well, hanging in here with us and sharing. So, folks, my guest is Dr. Luigi Boccuto. And today we're going to talk more about COVID. We've talked about this a couple of times. And it's been an area, of course, it's new still, really, right? It's new.
Yes.
But the ongoing research and
it had such a significant impact on everybody's life that it's hard to believe that it's just a matter of the last 12 to 14 months, really. So it is new.
Yeah, and you know, you're the person who enlightened me last time we talked about this, about how really this started late 2019. It just hadn't really gotten here yet, right? But we might have heard. I didn't hear about it until maybe a year ago, Wuhan, China, and this and that. But I know you knew stuff before this. Something was going on. So this timeline's been kind of interesting. Of course, the effects are quite devastating, it seems. So we're also going to talk about, we're going to touch on some ASD, autism spectrum disorder, after we talk about COVID for a little bit, because Dr. Boccuto does a lot of research in that area. And so tell me, Luigi, what's happening since last time we spoke in the way of, let's say, COVID research? I'm curious about a few different things. For example, have we learned anything more about transmission of it? Have we learned about new strains? Possibly we're hearing about it on the news. Also, you know, some of the things, how people are affected. And my son, being in Atlanta, not far from you, emergency room physician, is seeing some pretty strange stuff, you know, lung issues, blood clotting issues, but more than that. And then the long haulers, we can save that for the last, but just curious, what's happening? What have you learned so far in this ongoing research?
Well, I would summarize the major news in three things. One, vaccines have arrived. Two, new strains, unfortunately, have been detected. Mm-hmm. And three, the therapy is advancing now. They are considering monoclonal antibodies. So there are these three major features that are, you know, on the horizon of the world after COVID-19. I would start with the vaccines, probably because they're the ones that we all hope will have the most sensitive impact. You know, that they will change the most our lives. Because let's remember that a vaccine is not a cure. A vaccine is basically a molecular instrument to train our immune system to recognize and attack a pathogen. So vaccines are not drugs that will cure COVID, but they will definitely make us stronger and more prepared to fight COVID. In some cases, it has been proved that some vaccines do have a beneficial effect, even in people that do have COVID, because they help reinforcing the immune response. Oh. But as a general rule, the vaccines are administered to people that are not infected. And in fact, if someone gets an infection of COVID, has to wait until, you know, getting the vaccine shot. Mm-hmm. And they do work as a prevention method. So vaccines have arrived. We all hear about at least 3 different vaccines. The one from Pfizer BioNTech that has been administered the most. Mm-hmm. one by Moderna and the one by AstraZeneca. There are differences, and there are some unique features for some of these vaccines. For example, the one developed by Pfizer and BioNTech has to be stored at minus 70 Celsius degrees, which is not feasible for all the, the hospitals and clinics. So there are some logistic implications, logistic hurdles, probably. But overall, there is a big worldwide effort to immunize at least the vast majority of the population at risk. So they've started with the healthcare personnel. They're extending now the vaccination to the older part of the population, people above 70 here in the United States, in other countries above 80, but they're trying to reach the population at risk. And then hopefully the plan is to try to vaccinate at least 50 to 70% of the population by the fall. So this is right now the best tool that we have to fight, COVID-19 is the best strategy that we have. But unfortunately, we could say the virus is fighting back, because the second point is new strains have emerged, and 3 in particular have been characterized. The so-called UK variant that unfortunately seems to be more infectious, more aggressive, and in terms of consequences, even more lethal. Then there is the Brazilian variant that also seems to be quite aggressive, and particularly seems to have developed some changes in the spike protein that is on the outside of the virus. Is one of the things that gives the virus that sort of look that gives the name, the coronavirus, because it has like a crown, and those spikes that make the crown are actually generated by this protein called spike protein. So the variants, most of the variants in these new strains affect spike protein, and particularly in the Brazilian variant, there are 3 major changes in amino acids of this protein. And that seems to make the vaccines slightly less effective in fighting, or better, in training the immune system to recognize the virus. So if you change the target of the immune response even slightly, the immune response may be less efficient. And then there is the variant, that's the third one, that doesn't seem to have a clinical impact comparable to the other 2, but still introduces some changes. So it makes the whole scenario more complicated. And the third point, the monoclonal antibodies, which seem to be, the most powerful therapeutic strategy, the most powerful option that we have on the long term. But let's not forget, this is a very promising strategy, probably the most precise that we have. But it is quite laborious, it is quite expensive, so it might take time to reach the vast majority of the population.
Sure. My wife is actually, she retired 2 years ago from her job at the school district this coming June. But she came out of retirement, she was recruited as a nurse, registered nurse, to give vaccines. So she started 3 weeks ago. As a matter of fact, I think this week is the first time, first wave of second dosers coming in today, as a matter of fact, because it's 3 weeks ago today they started. They're doing the Pfizer, which they have this special freezer, which is very, very cold.
Yes.
And people are coming in from all over the state. They're coming in from all over because so many people want the shot. I have a question. Actually, Laura has a question. When a person gets their vaccine, can they still pass the virus somehow? And let's see, maybe they don't get it, but they have some. Yeah. So once you get the vaccine, this is a question I was going to ask. Thank you, Laura. Good question. Is it possible to transmit the vaccine or carry it if you've had the virus, but you don't? I mean, had the vaccine, you don't have the virus, but can you still pass that to somebody?
Can you still pass the virus, you mean?
Mm-hmm.
So when you get the vaccine shot, you don't acquire immediate immunity.
Mm-hmm.
It takes time to build up your immunity. And that is why you need, with the Pfizer BioNTech vaccine, you need 2 shots at about 21 days, the distance one from another.
Mm-hmm.
After the second shot, it will take about 10 to 12 days to reach, the full immunity. And unfortunately, but as you said, so far the data are limited. But unfortunately, it seems like that immunity is not permanent either. So at some point, it might be necessary a booster shot, something that will will ignite again the immune response to solidify the capacity of the immune system to respond to future infections. That said, if you do have an incomplete immunity against the coronavirus, what could happen is that one, you can get full infection because your antibody response is not strong enough to fight and eliminate the virus from your body. Mm-hmm. You could be just asymptomatic, so you can carry the virus but have no symptoms. Or 3, your immune response might still be successful. Of course, these are the scenarios in case you get in contact with the virus. So the third hypothesis is that you can still have a successful response, but there is still a window. You still need to give your immune system time to attack and destroy the virus. So there is still an opportunity, although, in the third case, very slim, you have very slim chances to pass the virus, to be a carrier that has the virus for a very limited time and still able to transmit that. Of course, if you have a full infection with symptoms, or if you have an infection, you're asymptomatic, but your immune system is still too weak or too untrained to develop a proper response, it's pretty much the same situation as you didn't get the vaccine, but because it's still early in the process of building your immunity. So yes, the vaccine, especially in the early stages, especially before the second shot or up to 10 to 12 days after the second shot, does not give you immediate immunity. So you can still get infected, you can still get the full COVID-19 symptoms, and you can still pass it.
Okay. Thank you. Thank you. And Laura says thank you as well. And by the way, if anyone has questions, just put them in the comments here, or if you're on Zoom, just throw them in the chat box and we'll ask away. So before we talk about long haulers and things like that, I'm curious about prevention besides the vaccine. Because I do have another vaccine question, but I'd like to go over to the wearing of masks. So there's I say this respectfully to those who are watching who don't think masks are effective or work. And I have enough knowledge to know that they can help to prevent transmission, help to prevent maybe receiving, getting the virus too. Do you mind sharing with us about your thoughts on mask wearing? And I know we talked about this before, but has anything changed on that as far as benefits of wearing a mask?
Now, I understand that some people manifest some discomfort.
Mm-hmm.
It might be unpleasant, and might be something that is hard to accept, and it might interfere with the everyday activities. And I'm respectful to that. And some people are legitimately asking, okay, now we have vaccines, do we still need masks? Well, the answer is yes. Because one, we just said before, even with the vaccine, you can still carry the virus and pass it, even if the chances are much, much lower. Two, there are people that could not get the vaccine yet, and there are people that could never get the vaccine because people that have immune disorders, or they're going under chemotherapy, or they have other sort of illnesses that are in conflict with the vaccination and immunization process. They just cannot receive the vaccine. So we need to be considerate for everybody. We always said during our pleasant conversations, this is a matter of community medicine.
Exactly.
We need to reason in terms of the whole society, the whole community. So in terms of being responsible to the other people around us, not just us, we have to maintain the safety measures, wearing masks, wash our hands, maintaining social distancing, because you never know what's the immune status of the person next to you. You never know if that person has been exposed to another strain of the virus that may elude the vaccine effect. Yes. So it's always a matter of being prepared for the worst. Sure. So use whatever tool, whatever weapon we have to protect ourselves and others.
Right. And we did talk about that quite a bit. You were a guest at our Parkinson's workshop back in September, I believe. And then before that, we had spoken too about the idea of community. Like, it's not about me, it's about we. And, I've posted about this as respectfully as I am in the mood to be at the time I post. I have my moments of frustration, but I understand. I really do. There are times I just want to rip the mask off and say, you know what, whatever. But I have a granddaughter too. She's 3 months old yesterday. Do I really want to take that chance? And no, I don't want to do that. Do I want to do that for anyone else? Anyone? No, I don't want to do it. So I get used to wearing the mask. I still don't enjoy it, but it's not a matter of how I feel. It's a matter of how we do as a community. It's been so devastating. So devastating. My son, going off just a little bit on a tangent. He's an emergency room physician. He's at Emory. There was a lady who came in, 28 years old, fourth year medical student, maybe 3-4 weeks ago, asymptomatic. She had COVID. She didn't know it because she hadn't tested. She had no idea. Was in a car, I think maybe riding as a passenger. Started coughing. Yes, Laura, social responsibility. Thank you. And I believe coughed up some blood or something. Went to the hospital, and she died. Sadly, she died. 28 years old. Well, afterwards, they realized she had COVID. No symptoms. So I don't know the rest of the story. I don't know, if they had done an autopsy. I don't know if there are underlying issues. But the bottom line is, it seems that maybe COVID triggered something. I mean, I'm hearing stories about how it can ravage the lung. Yeah. I'm hearing stories about people with neurological diagnoses on the rise after having COVID. So it seems like there's a lot that can happen from COVID besides just feeling really crappy. So what are you seeing in these areas?
Well, the molecular target of the SARS-CoV-2 virus, which is the virus causing COVID-19, is a membrane receptor of our cells called ACE2. Mm-hmm. ACE2 is also targeted by several drugs used to fight hypertension, type 2 diabetes, and unfortunately, there is a sort of a vicious circle, because individuals that do suffer with these sort of problems, hypertension, diabetes, obesity, tend to express higher levels of this ACE2 receptor. So they are prone to have a more severe infection by COVID, by SARS-CoV-2, because simply there are more targets for the virus to attack our cells, to attack and penetrate our cells. So it is really hard to identify individuals at risk, because especially when we talk about these surprising young cases, because we, at least from the first months of the pandemic, we tended to associate the severe cases with older age. We now know that that's not always the case. And it might be related to the fact that these young people are genetically predisposed to develop hypertension, diabetes, obesity. If they're not, at the moment they get COVID, suffering with any of these conditions, but they might be expressing higher levels of ACE2. Since these are all complex disorders, the disorders might not manifest just because the non-genetic components, non-intrinsic components, so diet or exercise, are in favor of these people. So if we're talking about people in their 20s, even if they are genetically predisposed to be obese and develop diabetes, perhaps they don't show that yet because they're eating healthy, they're doing a lot of sports, they're just, their body's stronger, so their metabolism is running faster, and they can handle better their genetic, negative load that will predispose them to develop diabetes. But the genetic imprint is there. So the high level of ACE2 receptors is there. So that predisposed them to a more severe response to the COVID-19 infection. And of course, these are all hypothesis, speculation. We don't go and characterize molecularly every single patient. And that is why, the three variants, the three new strains that we discussed before, they're just three of potentially hundreds or even thousands of new strains.
Sure.
Because, the virus has been around for over a year, and the basin of potential hosts is unlimited, Yeah. It's virtually the whole population of the world. So it is not impossible to hypothesize, to infer that there are several strains that are out there and are affecting the different phenotype, the different clinical presentation of COVID-19 without being characterized.
So have you noticed, have you seen any kind of numbers on the rise as far as any kind of like neurological diagnosis or neurological issues from people who've had COVID?
Yes, I don't know if we discussed this last time, but there is a very nice paper that has among the authors our common friend, Alfonso Fasano, who's a professor of neurology in Toronto. And that paper did prove that individuals that already have neurological disorders tend to experience a worsening of their symptoms with the COVID-19 infection. And that might be related to the fact that the brain is one of the tissues that in normal conditions, so, without hypertension, diabetes, and so on, but in normal condition is one of the tissues with the highest level of physiological expression of ACE2. So then, and we learned about COVID-19 as a respiratory infection.
Right.
Through these months, we began to learn that there is so much more. There is a compromise of the vessel walls, the cells that are wrapping up, the blood vessels. and that leads to several vasculopathies, several circulation problems with coagulation problems, and so on. There are gastrointestinal issues.
Mm-hmm.
I was privileged to be part of a couple of studies with some Italian colleagues headed by my good friend Ludovico Benavoli. And those studies show the impact of COVID in several gastrointestinal disorders, particularly chronic intestinal disease like Crohn. So there is a plethora of manifestations. There is a plethora of satellite symptoms that are very different from one person to another because the individual background changes in terms of genetic profile, in terms of environment, diet, drugs, a lot of things. But also because the virus changes. So strains may lead to slightly different symptoms. And so we are learning that, COVID-19 is a multifaceted disorder that primarily may involve, the respiratory system, but it does have a significant impact on other districts as well.
Interesting. If you don't mind, I'm going to go just a little deeper. And we spoke about this back in September when you were so generously a guest presenter at our Parkinson's workshop. And actually, I have a question from Laura, who was there that day, who lives with Parkinson's. Is there any information on COVID and Parkinson's patients? In other words, is it possible that any of the Parkinson's symptoms may worsen if they get COVID?
Yes. I'm not an expert in that field, honestly. And I think that the work by Alfonso Fasano and others, did a good job reporting these sort of problems. And I know that there are other works along that line of research as well. There is definitely evidence of worsening of symptoms because one of the major pathogenic mechanisms through which the SARS-CoV-2 virus exerts deleterious effects is the so-called cytokine storm. And that is due to a series of exaggerated immune reactions in various tissues mediated by cytokines, which are like immune messengers, particularly interleukin-6. And that cytokine storm causes a series of inflammation processes in different districts. So when it affects the brain, the storm does cause worsening of the symptoms, Parkinson's symptoms. And plus there are certain clinical overlaps, like individuals with Parkinson experience a loss of the sense of smell. And we know that that is one of the most common signs in COVID-19 as well. So again, it depends from person to person because not everybody that is symptomatic to COVID-19 goes through the cytokine storm, but definitely that is something that adds a layer of complications to the overall phenotype.
Sure. It's interesting. My mind is going a million directions, but if we look at inflammation, it seems that COVID usually will cause a lot of inflammation, maybe more than a lot of other viruses out there. And Laura says, thank you. And by the way, I meant to say, Laura, I'm pretty sure that I saved the paper that Dr. Boccuto is talking about, written by Dr. Fasano. I have a bookmark somewhere. I'm going to look for that. I'll send it. I'll post it later. And let's transition for a second. So I was diagnosed. I tested positive, I should say, on December 17, 18, 19, 20, 21st. I found out on the 22nd. The test was on the 21st. My symptoms started on the 17th. Which was funny is I had a test that day.
Which month?
Oh, I'm sorry. December. Thank you.
Okay.
My memory has been affected. So December 17th, I had a test because that was a Thursday. I get tested every Thursday because I need to produce negatives so I can work with people in some of the facilities that I go into, patients and clients. So that test the next day came back negative. The symptoms got worse. There were atypical symptoms, terrible like neuropathy all over my body. It was absolutely horrible. And headaches. I might have had 5 headaches in my entire lifetime up until this. And I'm not trying to direct this towards me and about me, but one of the things that I've noticed and I've heard about, my experience after, gabapentin took away the pain and I still had a lot of fatigue. It seems like, without going into too much detail, I think I had a lot of inflammation. And the sense of smell is still, as far as I know, I don't think I've smelled anything yet. Memory is definitely something it's getting better, but I have to write things down all the time or I will forget. Things that I don't forget, I'll forget. So I'm not trying to live into this like, oh, I'm getting forgetful. I think it's going away, but I'm actually trying to think of where I wanted to go with this. I think, according to my son and my general practitioner, who I really love, he's just great. I'm probably considered a long hauler because now I've 4 weeks in a row tested negative. And actually, I guess some people don't test negative for weeks or a couple months after they have experienced a recovery. Are you seeing anything in the way of memory issues, long haul, any kind of generalized long hauler issues that people are dealing with? And we're still kind of new in this, but maybe long enough that we can start to see some general symptoms or general issues coming up from long haulers.
Well, definitely there is a key word in what you just said. It is long. Like we haven't been able to record long-term effects, long-term consequences, long-term sequelae yet. That is simply because COVID has not been around. COVID-19 has not been around for long. But there are definitely several reports that are showing evidence that there are effects. Going back to the main district that is affected, which is the lungs. There are works reporting an increased risk of developing pulmonary fibrosis. So this inflammation that can spread in a very intense, even violent way for the tissues leaves behind some scar tissue, and scar tissue will never be able to replace the function of the original tissue, especially if it is highly specialized and very delicate, like in the lungs. So eventually that scar tissue might evolve into fibrotic tissue, and that will affect, the pulmonary, the respiratory function. So there are obviously long-term consequences, and as we said before, we still don't know very well what are all this brain level, the central nervous system level. And for that reason, it's not hard to infer that there might be long-term consequences, at the brain level as well. We all know that it's quite common to experience fatigue for a long time after getting infected. And perhaps, the loss of memory is just a symptom of brain fatigue, like the brain, just cannot put all the pieces together and hold them, long enough to generate memory to record something that will stay there for, long term. In fact, we know the most critical step in acquiring memory is the passage from short-term to long-term memory. Mm-hmm. So when you have something, that you did an hour ago, 2 hours ago, you might still remember it, for a few minutes, but then when it's time to put it in your long-term database, it doesn't make that step, and you sort of lose it.
Yeah. Okay. Well, that's interesting. I think, it's early enough in this. Just have to, see what happens over time, right? Continue with research. If anyone has any other questions about COVID, throw them in the chat box or the comments here. Now, if you have time, I don't want to keep you too long, and I think what I would actually do is do a quick pause here before we go into ASD, and I'll make a separate video out of it, just because it probably is a good idea to do. But when we go back to COVID, do you have any words of wisdom you want to share? Any advice you want to share for the general population?
I actually do, because I know that there are a lot of people out there that are concerned about vaccines and their side effects. And I know that there are many people referring some side effects or some very strong reactions, especially after the second shot of the vaccines. I want to say that, again, we need to think in terms of community medicine. This is a medical procedure that is helping everybody. And some side effects are possible. That is why vaccines must be administered in an equipped facility, hospitals, clinics, or even paramedical locations that are equipped with the trained personnel to manage potential side effects. And so there must be sort of medical surveillance. People are kept for about 15 minutes after the shot to detect any sort of discomfort and so on. The message is, don't be afraid of science. Medicine is not a perfect science. So we can never guarantee 100% of success. Right. And as we just said, we can never guarantee, what's going to happen on the long term. Like if we were waiting for the long-term effects of the polio vaccine, we had to wait another 10 or 20 years before getting the vaccine, and maybe, we could have still had people dying for polio. So unfortunately, no vaccine is perfect, no drug is perfect, and there are always those 1 out of a million unfortunate consequences, with severe responses, hospitalization, and so on. But we need to trust the process, because these vaccines that are out now are the outcome of an unprecedented worldwide effort.
Yeah.
It is really unheard of and almost unimaginable, until we actually got to see it, that in about 10 months, we had 3 different vaccines available. Right. This never happened in the history of humanity.
No, it hasn't.
Yeah, it was only possible because everybody around the world, in terms of research, academic institutions, pharmaceutical companies, everybody joined forces, and they devoted anything that they had in terms of fundings, equipment, expertise, personnel, time to work on these vaccines.
Sure.
That's because COVID paralyzed everything else. So basically, that was the effort. That was the fight of our time. And the vaccines are the weapon to win that fight.
Yeah. Yeah. Well, I appreciate you saying that too, because I think it serves as a good reminder of how unique this is. This has never happened in our lifetimes. We have not gone through a pandemic, of just most of us. You have the occasional, you hear about a person who went through 1918 virus. They were probably very young and maybe not remember it, but
Yeah.
so this is an unprecedented situation. The times are certainly different than anything else we've gone through time-wise and how we're having to deal with it. I know I'm a big advocate for social responsibility. It ain't about me, it's about we, and I appreciate your advice there, and also trusting science. I think that's a real big deal. I know there are people who don't trust, and I can say this because it's my show. There are also people who think the earth is flat. So, still, and I'm sorry if I offend anybody. I truly am. It's not my intention. We're allowed to believe what we want, but I really like to rely on the
Well,
experts.
again, there is a key word there that is belief.
Yeah.
When it comes to science, it's not a matter of belief, it's a matter of looking at facts.
Yes, thank you.
So if we're talking about belief, we're talking about the cult or religion,
Thank
call
you.
it, but it's beyond the scientific reasoning. You can decide to believe it or not, but science is true regardless if you believe it or not.
Exactly. There's nothing more for me to say. You said it perfectly. Thank you. And I'm glad you pointed that out too, because belief is it can be very powerful, but people can be sincere and also be sincerely wrong.
Oh yeah,
there. Right. So
yeah. I don't blame.
point.
I don't blame. The believers. I'm blaming the prophets. I'm blaming the people that are trying to spread these beliefs, and that's why I always say check the sources. For whatever you wanna read or you wanna get informed in, check the sources.
Sure. Yeah, and I'll just take it one step further, just real briefly. I mean, I've had my moments in my life where I've wondered about certain possibility of conspiracy theories and this and that. But first of all, I don't know if I'll ever know if any of it's true. Like who really killed JFK? I don't know if we'll ever know, and I'm not sure that it matters. I'm not saying it doesn't matter at all, but I'm going to move on with my life no matter what. And we've heard stories about little RFID, tiny little things being in vaccines, and then they can track everywhere you go because you got the. I just, if it was true, I don't care. I don't have anything to hide, but it just seems ridiculous to me. So I don't think this is an effort to control a population, or necessarily that COVID was manufactured in North Carolina and sent to Wuhan. I mean, I don't know, but I just can't.
May I say something about it? Because it's interesting. If you try, like it's normal. If you try to analyze all these points of view from a pretty neutral and detached point of view, I think it's quite simple to see their pitfalls.
Mm-hmm.
People are concerned about being tracked against their will.
Mm-hmm.
But they walk around with electronic devices
Exactly.
hooked to GPS, and they are constantly working, even when they're turned off.
Yeah.
And they are constantly connected to the web, to social media. They record everything, even their biometric information.
Sure.
And they give up willingly, pictures of themselves or the people around them. And they're tracked by, devices when they use an ATM or they pay with card. And they do that willingly, even if sometimes they're not aware of the full range of consequences.
Mm-hmm.
But I want to push this to the extreme. I'm going to be a little bit provocatory. They accept the fact of being tracked and scanned to post a selfie on Instagram, but they wouldn't accept, I'm not saying it's happening because there's nothing, no such thing in the vaccines, but they wouldn't accept to be tracked in order to get something that would save their lives and the lives of people around them. Mm-hmm. This is the thing that, to me, in the end, it's funny because, again, people are not probably aware of the world we're living in. And again, I'm not saying there is anything in the vaccines to track you or there are no microchips or anything. No such thing. But just hypothetically,
sure,
talking
yeah.
in terms of principles. Mm-hmm. People accept as a counterpart for being tracked or being monitored the posting of a picture themselves that will pinpoint where they are, what are they doing, who is around, what are they wearing and stuff. That they will accept as a counterpart. And medical, compound, a drug or a vaccine that will save their lives, no, they would not accept.
Mm-hmm. I'm really glad I'm glad I brought it up, but I'm so glad you said what you said, because it comes back around to I have to trust science in my opinion, right? I mean, not in my opinion. I don't know if it's my opinion. I just have to trust the science. I look what other authorities are out there who are gonna, well, there aren't any, who are gonna tell me what's real, what's fact, the evidence, the data. And it really loops back right around to personal responsibility, social responsibility, I mean, so that we can all get through this more and better. Mm-hmm. So if I brought up anything to anyone watching that is uncomfortable for you, I'm sorry in a way, and I'm not in another, because I think it's just so important to really look at the facts. And I love what Dr. Boccuto said here about tracking, because it's a conversation I've had with a few people. Tracking's been going on for a long time, whether we know it or not. If you don't bring your phone with you somewhere and you go to the shopping mall, I know in this mall here, you're on about almost 1,000 cameras if you walk from one end to the other. Yeah. They already know. They've been watching for years. And you know what? That's okay. I don't care. We have nothing to hide.
I mean, you walked into that, right?
Yeah.
You decided willingly to do that.
Yeah.
And you might argue, okay, where am I going to get my coffee, for the morning? Okay, so that is really the question, is there an alternative of living on the net, in a world that it's always tracking you? Mm-hmm. Probably not. But this is a predetermined situation that precedes by far, the vaccines.
Sure. Very much. Well, yeah, this has been actually very, very enlightening to me, very informative, as when I speak with you, I always learn so much. I appreciate this a lot, Dr. Boccuto.
My pleasure.
Out of it, but thank you everyone who has been watching regarding COVID-19 updates from Dr. Boccuto. Appreciate you watching. And thank you, Dr. Boccuto, for sharing on this. It's always so good to talk with you.
Yeah, same here. It was a pleasure.
Maybe later in the year, we'll talk again and see what's happening then. So Thank you very much. Have a great day, everyone.
Bye.